Everybody. This is Aera, and I'm here to record another class. So today we're going to be releasing the chest and the diaphragm. And I'll be showing two ways to do that. Um, well, three ways: sitting, standing, and laying down. In previous classes, I usually have a fair amount of self-care toys to aid in these processes, but this is a process that relies more on your breath and the use of your hands. There are some things that we can do to assist, using pillows and a couple of little self-care toys, and I'll talk about those, but that will be brief. The main thing to consider when you're trying to release the chest and the diaphragm is how comfortable you are with your own anatomy. And so for this class, I opted not to wear a bra because through my clothing, I'm going to be showing you how to manipulate the tissue around your breast, not in or on the breast, but your pecs are a major source of tension, especially if you're at the computer all the time or if you work out your chest or anything like that. And tightness in the pecs can translate up into tightness into the neck as well. And it pulls the shoulder forward and in. And with most of us at a computer, what are we doing with our shoulders? Forward and in. So the goal is to try to figure out how do we encourage our bodies to be open and released. Open and released. And we can do this with manual hand techniques, some self-care toys, but also with our breath, giving ourselves a little bit of feedback. So the first thing we'll go over is a little bit of those self-care toys because, well, there just aren't that very many. Y'all have seen this before. This is a
Oh,
tread
yeah.
wheel. I talk about them. I have the whole set here. And because I have show these in my health coaching sessions and I talk about them enough in my sessions, I'm not going to demonstrate. So these are basically like yoga wheels and they come in different sizes. And the reason why they're important for this is because they help put a little bit of gentle traction onto your spine. And the smaller they are, the more specific and the more intense it gets. So when I'm thinking about assisting the release of my chest and my diaphragm, I'm mostly looking at the first two larger sizes. You can get these as a set, and I'll have these in the description for the class where you can buy them. I don't get any kickback from them. I just like to show them off. So these two sizes are the ones that I would use for this. And I would, if you're someone who can get on and off the floor easily, and if you are somebody with dysautonomia, you might want to do this slowly, or you could do it against a wall, a sturdy wall, like if you have a brick wall or something, that could work as well. And I would get your back on it and get into the bridge position. There are lots of videos on YouTube that show you how to use these. And I would simply be on it long enough to produce some feedback for your spine and your muscles. Some people feel like their back cracks on it, and that's okay. And some people feel like they get like a good stretch of their upper back muscles. That's also okay. But I wouldn't want you to like be on them for longer than a minute or two. And then you can like take a break and come back on it. That repetition of sliding your spine across it a little bit helps put the feedback into your nervous system so that it tells you where you're actually supposed to be. The little bit of decompression between your vertebrae when this happens can be enough in some cases. Your mileage may vary, but it can be enough in some cases to give a feeling of gentle engagement that makes the body feel more relaxed and calm. So if you're curled in a lot and you're trying to get the tension out of your chest and you're trying to make your brain more naturally come out of that position, then starting with one of these can be a great way to start to facilitate that with your nervous system. And then, and again, you can do this any way you want, like with my intraoral classes. Sometimes people go straight to the heart of the matter and they get right inside their mouth, and that's good. And other times people feel that they have to do a lot more stuff with their hair first. So the order doesn't really matter that much. But in my mind, when I'm doing this stuff for myself, if I'm really struggling with it, I use the sharp wheel first, and then I go into gentle mobility. I feel where I am in space and time and move my joints. And then I will move into specific hand techniques I use my hands or some of the other stuff. I'm just going to slide those back under the couch. That's where they live. So once I've done the stuff with the chirp wheel, then I might feel, where am I? And I'm going to move my arms. And when we have dysautonomia, raising our arms above our head might produce symptoms. If it does, you feel like you can, just use one arm. That's just a real gentle open, like a big wave. Like, hello, I am here today. Despite the world being a dumpster fire, I am here. And I might do that a little bit. The repetition itself can be soothing, especially if you happen to be on the neurodivergent spectrum. That can be very useful for your nervous system. And then I might go into other traditional shoulder warm-ups. Go clockwise, counterclockwise, whatever, do that. Shake stuff out. So I'm really just trying to feel where my muscular tension is. I'm not intending to work out. And this is not physical therapy. This is just an exploration of our range of motion. And that exploration itself can be very helpful because it does, like this action here is pumping blood. We're pumping blood now, right? So when we do things like that, we're pumping blood. And that pumping action itself gets nutrients, it reduces stagnation, it encourages our lymphatic system, and it gives us something to do with our body and kind of let our minds check out a little bit. As long as we're paying attention to what's happening, and as long as we're not trying to do excessive range of motion. So for people who are hypermobile like I am, like I'm just lacing my fingers for the feedback. I'm not actually stretching my fingers. I'm just going this far. Things like this, Most of my action is coming from my shoulder. I don't feel any tension in my wrist or my fingers. I'm not stretching. I'm not bending back. See that? I'm not bending back. Those kinds of things, sort of threading the needle type stuff. Now, if you start to get tired in your shoulders like I am, it's a good indication that you're now in like workout territory, like starting to feel kind of tired through here. So I'm going to stop doing that. So, we've got things like the chirp wheel and we've got range of motion stuff with our arms, just kind of feeling where we are. Repetitions. These repetitions are important. You're not doing one or two. You're doing like 5 or 6, 7 or 8 in short bursts. These short burst movements. It's not stretching, it's not strengthening, and it's just like a gentle warm-up. so that we can get blood flow and oxygenation back through, we encourage the lymph flow. And we get ready for the manual work that we're going to do. The other thing, and I'm kind of a problem solver when it comes to this, I'm always thinking about how to modify things, is we can use something like a pillow. Now, you might be able to use a squishmallow for this. I know they're kind of popular. I have one in the other room. And this pillow is a little firm, but it's got a lot of bounce to it. And it's not heavy. It's just like a little pillow. But giving yourself a little bit of resistance can be helpful for the pecs. And what I mean by resistance is I'm not talking about like resistant bands. I'm talking about just giving yourself a little bit of feedback. So if I take this pillow and I kneel on the couch so you can see what I'm doing, and I turn this way, and I just squeeze with my pecs. So I'm just squeezing that. It's just a little bit. This is like probably maybe that's probably less than 5 pounds of resistance. Like it's really not much at all. And if it's too much, then this is not the proprioceptive activity for you. But I'm gonna just like that. 1, 2, 1, 2, release. 1, 2, release. 1, 2, release. And I can feel that in attachments of pec minor and pec major. And I can feel that a little bit in my neck. If you feel it a lot in your neck, this is not the exercise for you.
What if I feel it more in the front of my chest? I'm not feeling
Where
it
pec
much
where
here.
pec major attaches, your pec major is
Yeah.
engaging.
Okay.
Hold
Okay.
up your pillow again. I'll hold it all the way up so I can see how big it is. Okay, it's a little bit bigger than mine.
It's pretty small. Like it looks, I think that's kind of like the the aspect ratio of the camera maybe because it's a pretty small pillow and
Okay.
it's not giving much resistance. It's very squishy.
But it is definitely telling you that you can feel your muscles engaging here.
Mm-hmm. Mm-hmm.
That's good. So when we use a pillow this way, we're trying to see what muscles we're recruiting. I have a tendency to recruit my scalenes, right? So
Mm-hmm.
you can also experiment with it up above, and it's just a test, you
Mm-hmm.
know? It's just a proprioceptive test. Bring it down to your belly, do the same thing. And then here, when I bring it down to my belly, so when I'm holding it like this, then I'm feeling it. I'm actually feeling pec major now. And that muscle is a little weak on me. I got stronger pec minors than I think I have pec majors. And our pecs, cover a large area of our breastbone, and they attach to the front of the shoulder here. And the thing about pecs that are overactive or that we feel a lot or that are pulling us forward and in or that we're engaging a lot is that it puts strain on the upper back. So a lot of people will come to me for massage and they'll be like, oh, my upper back's bothering me. My upper back is bothering me. Between my shoulder blades is bothering me. My neck is bothering me. Okay, I can work on those. But unless we address the front and our abdominals too, we're not going to address the whole picture. The majority of individuals in my country are on a phone, hunched over. We're on the couch, curled up. We do a lot of fetal position. It's a very comforting place. And it's a place where a lot of people get stuck in for sometimes hours at a time, dissociating on their phones. And I'm not perfect either. I literally, if I am not working, this is what I'm doing. I'm flat out honest with you. I am absolutely notorious for this, which is why I've developed these techniques because I can't go get a massage every 2 days. I would love a massage every 2 days, but that's not practical. So here we are. Okay, so proprioception, range of motion exploration, chirp wheels. What's next? Well, what's next is let's do some exploration with our hands. And I forgot to put on my brace, so I'm gonna go grab that. So that I have some support from my thumb. So if you're a person watching this later and you want to try some of this, make sure that if you have them, that you brace your hand appropriately if that is something that you know that you need to do. So make sure that you're resourcing yourself that you so that you can do this. So in my case, I'm wearing a swan splint and a push brace for my thumb here. And my watch is getting in the way, so I'm just going to shove that in my pocket. Okay. So this section of the class material might be awkward, but your pec muscles live under your chest. And individuals with smaller breast tissue or no breast tissue, they may find this portion of the class less awkward. And then people who have larger breast sizes or larger pecs or what have you, they might feel a little uncomfortable. So it's up to you to decide how you want to interact with this material. But one, my shirt is definitely not going to come off. I'm going to be working through my shirt. And two, I've been doing this enough and I have enough education to know that these techniques that I'm showing, if they are done mindfully and they are done with intention, you're not going to hurt yourself, but you may find that it can feel really intense. This area of our body does not get touched very much. Especially for those of us who are identified as female at birth or who um, happen to have like larger breast tissue, we get a lot of unwanted attention here. And so it's very natural that we would close ourselves up. It's a very protective way. It's a way to seal our energy off from others, and it's completely valid. And so all I'm asking for anybody watching this to do is to consider these techniques and think about how you can find a space and a privacy that you may need to do these techniques. There will be a portion of this where I will actually be pulling up my breast tissue. I will be holding my breast. It's not weird, I promise. The purpose of that is literally to take pressure off of my chest that's underneath it. So as a non-binary person, I personally view my chest as kind of like part of my body. It doesn't really feel like a part of my gender, so I have a different relationship to that than others do. Then you shift your perspective from this being a part of your sexuality to this is part of your anatomy. Interacting with this area of your body may feel more comfortable. So just keep that in mind. Do I have any questions before I move into that segment?
I'm wondering if I should probably lose my undergarments underneath my shirt to follow along, 'cause I probably can't really access.
Yes, that's a great question. So if you feel comfortable to do that and you feel like your shirt will give you the modesty that you need, that's completely fine. I could not tolerate the underwire of my bra, and I really want to be able to get up underneath. Like my breast tissue tends to hang quite a bit, so I have to really scoop up under them. And a bra just was not gonna let me do that without pushing that underwire into me deeply, and then uh this part of the bra, whatever this part's called,
The yoke or
yeah, whatever it is that
neckline,
goes across your
whatever.
sternum.
Yeah.
Mine on my bras are really stiff, and again, it's uncomfortable for me. So if that's something that you would like to do, you can do that.
I'll be right back.
Okay, I'm gonna take a sip of water. I actually, to prepare for this class, I actually thought about how I was going to present this segment for like a long time because I wanted this to be trauma informed and I wanted to be a grounded approach without it feeling weird or sexual, because that's not what we're doing here. But I also want to make sure that the applications are made really clear and I want to be as thorough as possible.
Yeah.
Okay, you feel better? You feel more free?
Yeah, definitely.
Great. Okay. So let's start at the sides. So, in my hands to shoulders class, which I know some people may have already taken, we did some work already with the shoulder and the armpit. So we're gonna revisit that. Now I am sweaty for some reason, so it's probably gonna show, and that's just normal. The body is not an apology.
Word.
So the armpit has your pec, right? And you have your latissimus dorsi back here, your serratus anterior, so you punch the face muscle. So we're gonna be here at the pec again. And you can see that shadow. This is the backside of the pec minor. And I'm gonna take my finger pads and I'm gonna curl in and place my arm down. So I'm curling in so that I can grab that. And I'm going to push them down. I'm gonna bring my arm down and I'm just going to grab my pec. I'm gonna flex it just to make sure I have it. Yep, I have it. And actually flexing it a little bit like this. So you see how I'm kind of engaging it? You
Mm-hmm.
should feel it contract under your thumb and your fingers.
Mm-hmm.
And when we do that little action, a little tiny action, we're telling the muscle to reset itself. And I'm just gonna do that a little bit. And then maybe I'm gonna hold the contraction for a little bit longer and then I will release. So that's one way to approach it. The other way is to, when you go to scoop in, I'm gonna come down to the bottom. So almost where it's like on my breast tissue. Well, I'm almost on the tail of my breast, but you see I'm here at the side, and here at the side, and they come up. And I'm going to take my fingertips and I'm gonna scoop up and curl up in. And then I'm gonna pull. You see how I'm pulling that tissue up? I'm basically sliding the skin up towards the clavicle, like that. And I'm just gonna sit and hold it for as long as I need to. So typically I know that I'm done holding it when my body starts to feel relaxed and calm, or feel my shoulder drop, and or I wind up taking involuntary breath. And there we go. My shoulder dropped a little bit. I had an involuntary breath. We always slide out with respect. We don't just drop our bodies after we've been holding them. So part of this work too is like, how do you hold yourself and be present with yourself and patient with that process? That in of itself is kind of an active form of meditation, in my opinion. So I did that. And then I'm going to check my range of motion again, and I'm going to just feel my shoulder. And, it feels a lot better already. I even feel a little bit of a release in my neck. So we're going to go to where the clavicle is, and we're going to drop down a little bit so that we're in this kind of flat part of our upper chest. And I'm going to just expose my shoulder for this, but I'm going to come down a little bit more, probably to where like my cleavage would start to be if I were wearing a bra. And I'm going to scoop up my skin. So this is what I'm doing. So now come closer. I'm down here. I'm gonna scoop up. See how that moved? Up like that towards the shoulder. I'm gonna just hold it. This may or may not be technique that some people can do. Kind of requires that you're able to hold that tissue, and you're just sliding the skin up. You're not trying to like push the muscle up or anything.
Oh, okay. That's different. I was
Yeah.
definitely pushing on the muscle, but yeah, if I just do the skin,
And then see how we slide back. I maintain contact. I bring it back. And then I lift off my hand. It feels a lot better. And actually, some of the achiness in the back of my shoulder is now gone. And I'm noticing the achy areas on this side in the front and the back. So let's do the other side. So I'm going to come up, find the right spot. There it is. Right there it is. And then I'm going to curl in and hold. And then I'm just going to contract. Just like that, nice and gentle. It's sore on this side for me for sure. If you have one side of your body that has like vascular compression issues or is more hypermobile, you will find that when you get into these areas on that side, it can be more sensitive. As I do this, it gets better with every pass. But I know that I'm really sensitive in there, so I'm not going to do the full amount of time I would do just because I don't really want to experience the pain. And then, like, that's your choice. So, some of these things feel intense. You can do a little bit, or you can keep going, and there might be a peak of intensity, and then it'll drop really quickly and then plateau. But I'm just choosing not to do that to myself today because I'm exercising my agency to make a choice. So what I will do instead is I'll see if picking it up and doing a slack. So I want to go back down to the bottom, right, and come down here. And then I'm going to bloop. So you see how much movement that is? Bloop. Okay. Then I'll move my arm down. Then I'm just going to sit and hold. Now, if your hand's fatigued during this, stop, rest, do it again. You can do it in shorter bursts. You can hold it for as long as you're able to, that is comfortable for you. You do not have to push yourself to do that. It's just little increments whenever you can. That is how I manage the chronic pain that I have, that my medication does not touch, is little increments like this. Oh. And that was the technique that I needed. The other one, it didn't like. It definitely responded better to this one. So that's why I teach a variety of stuff here, because there's so many different ways to talk to your body. And you just have to find what works best, but doesn't put your nervous system into overdrive. So I'm gonna check my arm. And yeah, that's starting to feel a lot better. Um, Notice my shoulder joint is a little stiff, so I'll show what I would do for that. So here's the shoulder joint, and I'm just gonna put my hand on top, and I'm just gonna like kind of pretend that my fingertips are little suction cups, and they're just sticking my hand there, and then I'm just going to manipulate the skin. See how I do that? Just manipulate it. Rolling it over that ball and socket joint. Oh, well, I found a position that was great for it right there. And then sometimes you have like a good gentle hold on your skin and you sort of like socked it. Like you can imagine that your skin is like a sock and you've bunched it over like the heel of your foot and you're moving that sock around. You can take your arm and rotate it in and out. And this threads the tissue underneath. It's another way to release your fascia. And you just do it real gently, really slowly, and then you can just slowly let go of it. And I like to do after I do stuff like that is I like to wait a couple of seconds before I move my arms, just so that my nervous system has a chance to register that. And I can tell you already, my fingertips are warm now. They were cold when I started. I have blood flow now in my hand. And that's because a lot of people get locked up through here. They get locked up through here, and then what happens is that these blood vessels are moving slower. And this is the side that I have vascular compression on from like a secondary thoracic outlet syndrome, which is related to having Ehlers-Danlos. So whether you have something like primary thoracic outlet syndrome, you have Raynaud's, you have Ehlers-Danlos, something like that can be helpful to get the blood flow back into your hand. Even my hand feels better at this point. My hands often feel a little tired and achy, and now I feel like my hand is more alive. So we're going to come back up. So again, I'm going to show my shoulder. Here's a clavicle, and I'm going to come down to where my cleavage would be if I were in a bra. But like I said, mine hang, so I'm going to just scoop up. And sometimes you can't go very far. Sometimes the skin I'll let you go further, and sometimes it won't, and that's okay. There are many different reasons why when you do a skin move like that and your skin isn't cooperating as well, that just means that it probably needs more time or it just doesn't do that. Like every body is different. The important thing is just to get some movement up. That was nice. So let go of that. I'm gonna check my shoulders. And I'm getting more range of motion in my shoulders now. I'm feeling better. I'm gonna gently move my neck. I'm not trying to like crack my neck, pop my neck. I'm not trying to stretch my neck. I'm just doing a little gentle movement with my neck. Um, and yeah, I'm definitely feeling better. I'm feeling lighter in my upper back. It's not completely gone. I still have back of neck stuff going on. But that's okay. The main takeaway here is there's been improvement. And that's what you're looking for when you do these things is there improvement? Notice where you have the improvement. And then just keep practicing without overdoing it. I consider these approaches here to be actually fairly conservative compared to some of the stuff we see people doing online or things that massage therapists might have done. I know that I've definitely have received some torturous massage sessions, which it was not necessary. I don't think it's always necessary to torture someone to release their shoulder. There are many different ways that we can approach the body, and I'm always going to choose the least invasive, but still direct method. Okay. So before I move on to rest of pecs, which will include some of that work around the breast tissue, do I have any questions or anything to share?
I don't think so.
Okay. So let's get the sternum out of the way. The sternum, like the armpit, can be an angry place. We hold a lot of tension around our sternum, but we don't always register it. And there's just so much that happens here at the heart. Your heart is right behind here too. And your phrenic and vagus nerves cross through here as well. So if you have issues with your autonomic system or you have dysautonomia, you may be more sensitive to these manipulations, and they may be very therapeutic or beneficial for you. Or you may need to do them in smaller bite-sized pieces. So I'm gonna sit back here and I'm gonna show you where the sternum is. So we have our clavicles. We come up here to the sternal notch. Here's the top part of our sternum. We bring our finger pads down to feel. We're feeling for hard, bony structure. You may have more fat padding between your breast tissue, and that's okay. So if you're not certain, just run your fingers over lightly, and you can feel that. And then here is the bottom of our sternum, also called our xiphoid process. And that is painful on a lot of people because your abdominals, some of your abdominals attach there. And also your diaphragm is accessible through here. And you've got your liver on this side, and you have your stomach on this side, also accessible on just under the ribs.
Now, if the camera is reversed, is my liver on my right side or my left side?
Sorry, this is your stomach. See, I got caught up on that too because I'm looking and I think that's my left side, and I'm like, oh, your liver's here. No, this is your stomach. So
Okay.
this is my left side.
Okay, so this is my left side.
Yeah.
So
So
my liver's over here, my
the
stomach is here then.
stomach is on left, liver is on right.
Okay.
I
All right.
really do not like these reverse images. Um, okay. So the first one that we can do is we can just take our fingertips, and you can use one or both, but you're just rolling the skin with your fingertips. So like that. Little circles. We're starting near the top, and where you see how much movement I'm getting? Play with that skin. And I'm applying just a little bit of pressure, not very much. And I can tell that I'm sensitive, but I'm just warming this up this way. That's all I'm doing. I'm just spending some time here doing that. I'm underneath my clavicle a little bit here. There's a muscle called subclavius, or no, well, you have the subclavian artery through here. And there's actually some lymph nodes through here too. This is also a lymphatic node. But underneath the collarbone, clavicle, we can even do little circles this way. And it kind of feels hard and gristly underneath the clavicle, like the part of a steak that you would like spit out. And it can feel weird. But just bear with me. The more we do this little action, the looser this is going to get. But you don't have to do it for very long either. It's just what you feel your body needs. And my body really feels like it needs to unlock up here at the base of my throat. I've been having problems with my throat recently, and then I've also been worn down by mast cell reactions. And when that happens, it creates a lot of anxiety and adrenaline in the body. And then my muscles are more tense in some areas afterwards, especially up here in my throat, where I tend to store a lot of tension and anxiety because of the reaction. And even in some cases, my throat may even have potentially swollen up a little bit during those reactions, or I have an excess amount of lymph fluid stuck up there. So this entire area, including my chest, just gets really congested. So I just took a dry swallow. I'm going to try with water. Oh, and I'm actually a little more open. It feels a little better to swallow. And I can't explain to anybody why that is the case for me. And it may not be the case for you, but that's what I noticed. Okay. So we unlock that, and then we can go up here to side of the sternum. And we can anchor our fingers into the edge of the pec major muscle. So to check to make sure that you're on that, do this, and you should feel contraction under your fingertips. And then I'm just going to push that together and lift up a little. And I'm going to hold. And I can feel my ribs. Now, sometimes your fingers land between your ribs, sometimes you land right on the cartilage. I'm right on my cartilage, and it is sore on the right side. On the left side, I don't feel it at all, but I'm on the cartilage. And a lot of people with Ehlers-Danlos get costochondritis, which is inflammation of this stuff, and it causes chest pain. And woo, so just a little intense. So you see that I'm rocking. I'm rocking because I really want to hold this because it is improving. But as I'm holding it and I'm in the attachment points of pec major, these are basically tender points. And I can feel also my ribs in my back. And I'm not applying much pressure. But the rocking is keeping me focused so that I can hold this. Because the longer I go, the more this is releasing. And I'm not torturing myself. This is within my threshold for intense sensation. Oh, and there we go. Oof. I'm just gonna slump back for a second. And I'm just gonna let go of that. And take my hands off. Have hands off. And I'm just gonna take a moment to thank my body for having this intelligence where we can do something like this. And in my case, I respond really well to it. Swallowing is also a little bit better. I don't know why that is. That's just the way that it is. Um, but you can see just a little bit where my fingers were. It'll make me a little red. And then I'm going to take my hand and I'm going to be between my natural cleavage. And I'm just going to roll over. I'm still over my sternum. My xiphoid process is right here. So I'm still, but I'm in the lower part of my sternum. And I'm just going to slide that skin around. This is so important. if you have asthma, if your mast cell reactions manifest as asthma in my case, um, if you're coughing a lot, you have to clear your throat a lot, you just got over pneumonia, doing this can be very helpful. We
Does it
don't,
matter what direction you go in at all, or should you change direction part way or anything
whatever
like
you
that?
feel, whatever you feel, whatever's comfortable. You notice I kind of do it always.
Okay.
'Cause I'm just trying to loosen up the fascial compartment over my ribs. And even I'll even cross over and I'll just gently pull through here. Because this part, this flat part, especially if you have a larger chest and you hang a lot, this is always being pulled down. You can see it too. You can see the lines on my neck. All of this is being pulled down by gravity. And with the excess load bearing of being like this on my phone or at the computer or curled up into a ball, crying about the state of the world, this gets really activated. These attachment points for pec major and minor, they're sore and angry on a lot of people. And this is an area of the body that not many people, for very good reasons, do not like touched and may not like touching themselves. So all of the focus gets put on the back, which can be a very, for some people, very safe place to have somebody touch you on the back. Um, but it's so much more than what's happening at the back, because what is happening here is really affecting the back. What is happening in your belly is also really impacting the lower back. And even the things that are happening in the pelvis are contributing to the discomfort that we're having in our back. And so, people get into these cycles where they can't cure their back pain, they can only manage it. And I think that's just a part, for some people, I think that's just a part of living in today's society with the type of technology we have, the type of jobs that we have, and the comforts that we have. And honestly, I think it's been that way throughout our evolutionary history. I think that the back and the perception of back pain is a very common problem. And a lot of people think it's really mysterious, and maybe it is. But one of the key points for treating back pain, addressing the front. And I'm not saying that posture is going to fix it. We have so many different postures in today's society. There are people with all sorts of postural issues that cannot be corrected. And to just focus the conversation on posture, which a lot of providers do, is not doing us a service. They really have to look at what's happening in our movement dynamics and how we can resource that ourselves at home.
Hmm.
So, okay. So now here's the part where I'm gonna take my breath, I'm gonna scoop it up. And you can try it now, you can try it later. Just have an open mind, okay? So as I said, mine are low. So I'm actually right here, okay? So I have to essentially come up underneath and I have to find, this is my rib. So right here's my rib, right? I'm going right just underneath. So I find that I lift myself up as naturally comfortably as I can without forcing it. And then I find my sternum and I come underneath that breast tissue. Can you see that okay?
Mm-hmm.
Okay. And then I'm just going to pull that up and I might let my breast hang over my hand. I may pick it up for more support, but I'm holding it like this. So it looks like I'm holding a baby actually. It really does. So I've got my baby and I'm just gonna hold. Now during this process, I have to raise the camera a little bit. So in this process, my shoulder's like this. I need to try to drop my shoulder. So I'm just using my elbow and my hand to hold myself up. Because sometimes the weight of the breast is too much to go over because this is uncomfortable for me. It puts too much pressure on my hand because I'm so large. So, and I don't even think I'm that large, but it's weighty. So
Yeah, I
I
was
don't like that.
noticing like that's really uncomfortable on my thumb if
Yeah.
I go around the tissue like that, but if
Yep.
I just go
Yep.
under
And you can
a
do
little
that
bit,
too. That's a good reminder for me as well. And you can even just do the inside edge. So there's many different ways to do that. So I could come up here instead and angle it like that. But we want the shoulder to drop. So think about the shoulder being dropped. Now this is like, and I'll show also how to offload your belly if you're able to pick up your belly. I can't tell you just like how actually helpful it was for my lower chest and my abdominals by scooping up my belly. It also helps the pelvis. Okay, see my shoulder just dropped naturally now, so that's great. Okay, so now I'm just gonna bring that down. I'm gonna let my arm rest. I'm gonna check it. My elbow's a little mad because it didn't really like that, but sometimes something gets kind of irritated when you're moving it to hold something else. And I don't have braces for my elbows yet. That comes next after all my finger braces come in the mail. I'm getting elbow braces. So I'm just gonna warm up my elbow for a little bit. Feels a lot better. Okay, great. I'm more open and free on that side. Okay, so for the next side, I'm gonna find it and find myself here. So you can do it both ways. You can come up like this, or you can come up like this. I sometimes forget which hands I'm using, so I switch it up. Yeah, and I come up right underneath on the outside. I'll scoop up, lift up. I'm gonna hold. I got my baby. Then drop my shoulder, and I'm just gonna rest in this position. So that is a lot better. I even feel my neck relaxing. This
actually
all.
feeling some tension in my neck from holding up.
Are you trying to like force it up, or you just hold it in the natural? Because yes, this would cause tension on me, but I'm just scooping up a little bit of the tissue.
Yeah.
And I'm letting my shoulder drop down. I'm keeping my neck neutral.
I think I just have tension in my neck no matter what.
I know that
But yeah, I think I definitely like uh maybe applying too much force.
yeah, yeah, that's the thing too. It's like we learn how we're overcompensating or how we're recruiting other muscles. Like I could feel my levator, the shrug the shoulder muscle. I could feel that being engaged. And that's why I was trying to focus on keeping my shoulder down in an appropriate position. But this is also my hypermobile shoulder. I didn't feel that on this side. I felt it on this side. I tend to recruit a lot more muscles on this side to compensate for the fact that my scapula is not as stable, right? Everybody's got all of these little pieces, and it's really interesting. You're constantly learning new stuff about yourselves doing this work. And I think that's like pretty freaking cool. Who knew that my autistic special interest would be this stuff? That's perfect. Okay. So we did that stuff. We did this shoulder stuff. We got underneath. And now for sitting up, we got to get to the xiphoid process now. So find the bottom of your sternum and then dip just below it. There's like a knot of tissue. It's very dense. It's
Mhm.
very steak-like. It's not like the gristle we had up here. This is like filet mignon, tough. Like, well, maybe no, it's like a New York steak strip, okay? So
Apologies to any vegans who take your class.
it's very dense. So we're gonna come up
Now, we're still on, are we just
just
under
below
the
the
rib cage
sternum. Then
or?
as you do this action, so like I'm kind of in the way here. As I do this action, you might go over the edge of the xiphoid process. So this
Okay.
is the attachment point for the rectus abdominis specifically. And
Okay.
it's can be a painful sore spot. So we're just gonna work it a little bit with some gentle circles.
I have accidentally on purpose Heimlicked myself before, so I tend to be very careful of this area.
Wait, what did you do?
A accidentally Heimlicked myself.
Oh,
In a CPR class or in a first aid class when they were showing us like this is what you would do if you were Heimlicking somebody, but don't actually do it because that area is very, very tender and I didn't
oh,
listen.
like
So
when you come up and go.
I really did like push into it and afterwards was like, oh, that's why they tell you to not do that.
Did you
So
throw up?
no, I didn't, thankfully. It felt really like, what is that?
Yeah. Yeah,
Esophagus
this
or
is
diaphragm. I was like very, very sore for days
yeah,
afterwards.
this is the part.
Yeah.
So, yeah.
And ever
Uh,
since then, I just like, I, yeah,
so that's
don't.
how you would warm that up, gentle circles. Um, there is, I don't have a big enough one. You see, can I do this with a pillow? No, that doesn't work. It would need to be like a little ball, and I have one that's too small and it would be too much pressure, but you wouldn't need a big exercise ball. You would need like
Like a melt ball or something.
a ball about this size. That's like you blow it up, or it's already blown up, or it's filled with gel. Um, like almost like a smaller version of those really pretty glittery balls that you get at like Target in the kids section. And they bounce really high, but they're just like air filled plastic balls. But you would need something that's a little bit smaller, and then what you would do is you would apply it here and just apply some
So
gentle
you have
pressure.
like a soft surface area to go over it.
Yeah. If it was just like a little ball. Like if it was just yeah. Anyways, otherwise all we mostly have is just using our fingertips for this one. But and I'm gonna show this standing up because sitting down you probably can't see it. So here's the bottom of my ribs, right? And this is my belly. So in order to come up and give some feedback into my diaphragm and my stomach, and I'm going to show this laying down in a moment too, but I'm going to find the bottom of the rib, right? I'm going to take my fingers and maybe I'll lean forward. I don't know, but I'm going to scoop up underneath
Kind of underneath the rib.
just a little bit. Yeah. See how I went in, but it's a scoop up. It's a scoop up. This is gonna be a really irritating place. I do this to my clients in session. I think I've done it to you. And it's not always a happy place either. But if we just gently do it, just a little bit. So if it hurts, back off on the pressure. But you're just gonna breathe with it. Just natural breaths. Like that. Then when you take a big breath, you can let it push your hands out. But that's how you would do that on this side. And then it's the same thing on this side for the diaphragm and the liver. Right there. I'm only bending forward because I'm standing. Otherwise, if I were sitting and laying down, it's not necessary in some cases. Oh, that was nice. I responded to that right away, and I even feel my lower abdominals releasing. I feel like my hips, the front of my hip is opening. Okay. So then here's the belly. So you can see here's my belly, no filters. And you can see how that's hanging over. A lot of people's bellies do that. It's okay. So I'm gonna come up. I'm gonna take that belly like this. I'm gonna pull that up like that. You may feel a little bit of a stretch in your groin. As long as it doesn't feel like it's tearing or causing you pain, if it feels kind of normal to you, then you've got the right amount. But you can always like let it off a little bit if it's too intense. So I've got my belly and I'm holding it. And I feel weight off of my groin. I feel weight off of my hip flexors. And I'm just holding my belly. I'm just holding my weight.
I think I feel weight off my chest.
Yeah. Uh-huh. So you're just gonna hold it. Oh, and then I want to slide back and let it do its thing. I definitely felt here. This is what we call the inguinal triangle, and this is where there's blood vessels and nerves. And I felt, and the attachment points of hip flexors are also in this area, and I felt this release as well. Um, Starting to feel pretty relaxed. Um, with relaxation comes with a dip in blood pressure. So for those of us with dysautonomia, keep that in mind. You could wear compression socks during these things if you want to, whatever it is that you need to do to take care of it. Okay, so I'm going to show how to do this laying down instead of sitting or standing. Um, the upper chest stuff, shoulder armpit stuff is pretty much the same. So I'm just going to show you how to do the belly and underneath the chest and underneath the ribs. So let me set up for that. And I think we're going to take a quick, like 3-minute break. So I'm going to stop recording. I'm going to pause. Okay, I'm back and I am in a lay down position where I have my legs elevated on something where that's a stack of pillows. I have a pillow underneath my head and I'm comfortable on my couch. You can get a blanket if this makes you feel better, like a weighted blanket or a regular blanket. I'm cold, but my blanket is not within reach, so that's just gonna have to be fine. So belly, sternum, this can be helpful for the chest as well. So I'm going to show it. This is our belly. And we're just going to basically make kitty biscuits on our belly. It's just it for this sentence, it's sort of like a sensory thing, and it's also a way to relax our nervous system and to encourage rest and digest. The parasympathetic state of the body. And it gets us in touch with ourselves and it helps us be more present. And it reduces our stress. It lowers our cortisol. Um, Everybody's stressed right now. You can do more muscular stuff if you want to like more knead, like you're kneading out a little bit of pizza dough superficially, not digging in. We're not trying to like grab or bunch it. We're being gentle and kind to this living organism. We're not going to focus on how much tissue is there or how little there is. It's just a body. It's just our body. And when we take care of it, it takes care of us as much as it's able to. So here I'm sort of like doing like a kind of like a wave motion. I'm using the heel of my palm to sort of like weave through the belly a little bit. And I'm not hitting it really hard. I'm not doing that. It's just real gentle rocking. And now my arms are a little tired, so I'm gonna rest for a moment. And the way that I like to rest is I like to have one hand like around my navel. I like to have the other hand up near the, my sternum, but in a lower sternum. It's gonna be a very anchoring place to put your hands. And I personally like to do this with skin to skin contact. Okay, so I did that. My hands rested. I'm gonna go back and show again how to get underneath here. I'm gonna put my feet up. So I make this so it's a little bit more in slack position. That I'm doing it by using my legs instead of my upper body. If I use my upper body, then all of my abdominals contract. If I just do it with my lower body, only the bottommost part really contracts. So here is, I'm just gonna pull this up enough so that you can see what we're dealing with here. So here's the ribs again. This is rib 10, and then 11 and 12 are your floating ribs. So this is rib 10, should be. Oh yeah, there it is. So, or that's actually one of the floating ribs. It should be, yeah. Anyways, so I've got a rib here and it's short and it stops right there. This section stops here. It's like the smaller. Yeah, this is rib 10, so this is rib 9. Anyways, that doesn't matter, sorry. Um, I'm gonna come down here and I'm gonna scoop up and I'm gonna say hello to my stomach. Oof. I'm just gonna breathe with it. Yeah, I'm not in that deep. I'm pretty confident with this move, so you don't have to do it like this. Don't push yourselves. I'm just, and then I'm also gonna take this tissue and I'm gonna feed it through. So yeah, just gonna hold it. Feel my lower back releasing. I even feel my leg releasing a little bit. Oh, okay, I took my breath, so I'm gonna come out. See how slowly I come out? I always spread that back out when I let go. Okay. Same thing on the side. I'm gonna turn slightly on this on my side, which is fine to do. I'm just gonna keep my leg up. Um, I'm gonna come in here. I'm gonna say hello, liver. My liver's probably been working really hard lately, processing all of my supplements, processing all of my medication, and all of the antihistamines that I take. So really appreciate my liver today. I almost feel this in my sacrum. I actually kind of feel it in my glutes, like on the side of my butt. It's kind of weird.
Now I look forward to trying this laying down later.
Again, I come back out and I let go of it. That. Okay. And then we can be at the Zyfoot process again while we're laying down. I have my legs straight again. You can bring your legs up if you want. But and then if I slide the tissue over my ribs, that can be really helpful too. Just like we did in our upper ribs, we do it with our lower ribs. So that can be great and helpful. And then the last thing I'll show before we wrap up is um if you can see this, I'm gonna take my hands, I'm in my ribs. My palms are on the side of my ribs, okay? And I'm just going to very gently push my ribs in. This may or may not be appropriate for you. You make that call, but my ribs don't subluxate, so this is okay for me. I'm just going to gently squeeze and imagine that I'm sort of holding a large plastic ball that has a little bit of give to it. I'm just feeling the resistance of that, all the fluid that is here in my ribs, in my lungs. Oh, I haven't done this in so long. Oh. Oh, my feet feel better. I don't know how that's possible, but I just feel so much better now. I'm gonna take a deep breath. Take my hands off. And so that can be a really great thing to do. I'm gonna sit up now, but I'm gonna sit up slowly because again, I have dysautonomia, so I need to be careful. So I'm gonna sit up here. Oh, I feel pretty good. How do you feel?
Much better than a couple hours ago.
Yeah, it's good
Been
stuff.
carrying a lot of tension around here, so this is excellent for that.
Yeah,
I feel much more open,
good.
breathing easier.
Any questions or clarifications you need?
Um, I don't, I'm I'm really good with visuals, so if you have any suggestions on like what um what parts of the anatomy we focused on today to go like look at anatomical
Oh, you want some diagrams?
yeah,
Okay.
yeah.
I can get those diagrams into the post I'll make about this on Ko-Fi once it's ready, like I did for the lymphatic drainage.
I, that's really helpful for me to just like zone in and like know what my
Yeah,
target is and also just it helps me to like synthesize the information and actually remember it moving forward.
absolutely. I can definitely get that stuff. Um, I might, if I can get someone to help me with this process, I could maybe take pictures of my techniques as well. We'll definitely get there as time goes on. Okay, well, I'm gonna stop recording the class now, but this is all gonna be here on the Ko-Fi. It's gonna be sent to everybody that has a free ticket as well, and then I will get the links and everything and stuff that I talked about together. So expect this in a little bit. But since this was done in April, everybody who is a supporter in April or before April will be able to access this even if they're not a learning enthusiast.
Oh, nice.
Yep.
Your birthday gift to all.
Yeah, no, I really like doing these classes. Okay, so I'll be around a little
Kisses. Happy
bit.
birthday.
Thank you. Oh, hello, Kitty. I'll be around a little bit after the class if people want to talk, but I'm gonna stop recording now. So thank you all for coming.